Senior Source is brought to you by Synergy Home Care, Intrepid Home Health, and Southeast Texas Cardiology Associates.
In this week's Senior Source segment, we have Melanie Garcia Montijo of Intrepid USA Home Health joining us. Thanks so much for being here with us today.
Thank you for having me.
Today we're talking about health care for seniors. Now let's start with how they can prepare for their health care.
So typically, every day we hear about healthcare changes and what's going on, and a lot of people are unaware of what's available to them. Medicare guidelines require that the things that they've already paid into with Social Security that Medicare will cover is home health, a skilled nurse to come in their home and help them, educate them, their caregivers, get them back. We can have physical therapy, occupational therapy, speech therapy, and get them back to being independent, back out in the community.
Now, who has the choice in making these healthcare decisions?
It is always the patient's choice.
Okay.
They're the consumer, them, and their caregiver. So, Medicare says they have the right to choose where they want services from. They can pick, so it's not their physician's choice or anybody else's choice, it's their choice.
And what can they do when they're making these changes or decisions? Walk us through some steps on what they can do.
So for instance, when you're out looking for what type of services you need, of course there always has to be a need. You have to show that there's Medicare will pay typically if there's a need to get you back to independence and what your needs are. And it has to be documented in a physician's note, and there has to be a physician's order. And with that being said, when you're looking for health care, you want to kind of shop around. Try to pick people or services or healthcare providers who have quality, who are providing quality care. So Medicare or CMS rates all facilities, hospitals, nursing homes, home health agencies, hospice companies, different things based on a star rating. 1 being the least amount of quality given, and 5 being the best quality of care given.
All right, and any advice for healthcare coordination that can benefit these seniors?
So typically, like if you're in a facility, like let's say a hospital, when you first get in there, tell your doctor, your nurse, and discharge planner who you want involved in your plan of care meetings. You want to be involved, and if you want your caregivers, your family, whomever, so you can make the choices. If let's say, for instance, they recommend home health services, ask for a list. They can provide you a list of agencies throughout the area, and you can also ask for their star rating, or you can go to the website www.medicare.gov, and then / if it's home health you're shopping for, it's a home health compare. If it is hospitals you're shopping for, it's same thing but hospital compare, or if it's a skilled nursing facility, nursing home compare.
All right, Melanie, with great advice as always. Thanks so much for stopping by, because I know that's a big issue right now, and there's a need out there, and so maybe they can go and they can log on to that website, medicare.gov, and hopefully find some answers there.
Yes, ma'am.
All right, thank you so much.
Thank you.
Jeff.